everyone, welcome back to our Literature Digest series on important allergy immunology scientific publications. Today, we discuss a publication by Dr. Yon Nguyen and Philip Dietecher. Dr. Nguyen is a practicing allergist immunologist in Houston, Texas, who has been working on systemic allergic inflammation and its implication on many modern-day diseases. Dr. Dietecher is a scientist previously at Baylor College of Medicine Department of Biochemistry and Molecular Biology. He has vast publications on autoimmunity and genetics. Let's start with today's discussion on systemic implication of chronic urticaria.
You ever get those allergies that just won't quit? Like you've tried everything, but the sneezing, the itching, those hives, they just keep coming back? Well, get ready, because today we're diving into a few medical case studies that suggest a wild possibility. What if those stubborn hives are actually connected to, get this, your lungs?
Yeah, it's a fascinating link.
We're talking about the idea that something like untreated asthma, or really any kind of lower airway inflammation, could be the hidden cause behind chronic hives. Even, and this is the key part, even when the usual allergy treatments don't work. So to explore this, we're taking a deep dive into two case studies from a recent medical journal article. The first case study focuses on a 26-year-old woman who'd been battling severe allergies basically her whole life. And I'm not just talking about the occasional sniffle here. We're talking allergic rhinitis, repeated lung infection.
Well, this is quite serious.
She even had something called eosinophilic esophagitis. Now, I know that's a mouthful.
It is.
Basically, it's when the tube connecting your mouth to your stomach, that's the esophagus, gets inflamed because of, you guessed it, an allergic reaction.
And what makes this case particularly interesting is that eosinophilic esophagitis usually shows up in childhood and often gets better around puberty. The fact that hers resolved, but then these other problems popped up later, well, it suggests something else might be going on.
So there's more to the story.
Definitely.
And it gets even more complicated because she was also diagnosed with a cat allergy, had reactions to vaccines, even seemed to have these allergic reactions to some medications. Then, around 20 years old, she started experiencing chronic hives and angioedema. Now, for anyone who doesn't know, angioedema, it's like hives, but the swelling is deeper in the skin. You get these larger welts, sometimes even on the face and throat, which can be scary.
Absolutely, it can be quite serious.
And this poor woman, she tried everything to find some relief. High-dose steroids like prednisone, the typical allergy pills, antihistamines.
Right, the usual suspects.
Even tried stronger medications, things like leukotriene inhibitors.
Which can be quite effective for some people.
And even omalizumab, which is often used in those really tough, severe cases.
Right, when nothing else seems to be working.
But nothing seemed to work for her long term. It got so bad, she was giving herself injections of diphenhydramine just to manage. And that's the active ingredient in Benadryl, by the way.
Wow.
Talk about a frustrating situation.
That's highly unusual. Most people with chronic hives, they find at least some relief from those treatments. So the fact that she was getting absolutely nowhere, that's a big red flag that something else was going on. This is where it gets really interesting, where the detective work began.
I bet this is where the doctors had one of those aha moments.
You could say that.
So as they dug deeper, they noticed a few things. Even though her lungs sounded clear when they listened to them, she had trouble breathing, especially during any exertion. Plus, she was constantly tired and sleepy, almost like her body was working overtime just to breathe.
It's like something just wasn't adding up.
Exactly. So to get a clearer picture, they ordered a test called spirometry.
Which, for our listeners, is a simple breathing test.
Right. It measures how well your lungs are working, how much air you can breathe in and out, and how quickly.
It's amazing how much information you can get from that one test.
And guess what? Her spirometry readings were way lower than they should have been for someone her age.
Interesting. So it's like her lungs were trying to send a message, but it was hidden in plain sight.
Exactly. And this hidden message, along with some other symptoms she had, like abdominal bloating and diarrhea, it started to paint a bigger picture. The doctors began to suspect that she might be dealing with something more than just allergies. They started to consider the possibility of lower airway inflammation.
LAI for short.
LAI. So not just a skin issue, but something going on deeper in her respiratory system.
Exactly. Yeah. And that's why it was a potential aha moment.
Makes sense.
Because LAI can be tricky to diagnose. It doesn't always show up in those typical ways we associate with lung problems, like you don't always have obvious wheezing or coughing. In her case, Those other inflammatory symptoms, the bloating, the diarrhea, those were crucial clues. Because when you connect the dots, they start to suggest a more systemic issue, something that could very well be driving those hives.
It's like her whole body was trying to tell her something was off.
Exactly.
So they had this hunch about LAI, right? What did they do next? Did they, like, put her on an inhaler or something?
That's exactly what they did.
Yeah.
They figured, let's treat this potential LAI and see if it makes any difference with the hives.
Okay, makes sense. Treat the potential root cause, see if the symptoms improve. So did it work? Did this new approach help her at all?
Well, they started her on a treatment plan that included a budesonide nebulizer.
A nebulizer, so that delivers medication directly to the lungs.
Exactly. Much more effective than, say, taking a pill for something like this. They also gave her a course of azithromycin, which is an antibiotic, just in case there was some hidden infection going on that was contributing to the inflammation.
Okay, I'm on the edge of my seat here. Did this hunch pay off?
Remember how I mentioned those aha moments in medicine?
Yeah.
This was definitely one of them. Within a week of starting treatment for LAI, her hives, they significantly improved.
Wow, no way.
And her breathing, night and day. She could finally breathe deeply and comfortably without feeling like she was working at it. And to really tackle things head on, they also gave her a medication called Dupilumab.
Dupilumab, that's a new one.
It is. It targets a very specific pathway involved in allergic inflammation. It basically helps to calm down that overactive immune response that's causing all the problems.
Okay, so that makes sense. But why would treating her lungs have such a dramatic effect on her skin? Like, those seem like two totally separate systems.
You're right. They are different systems. But this is what makes these case studies so fascinating. The theory is that in her case, that chronic inflammation in her airways, it was somehow triggering, or at least making the chronic hives worse.
So you're saying there's a connection between, like, the immune response in the lungs and what's happening on the skin?
It seems very likely. Think of it this way. If you have a fire in your basement, you're going to smell smoke throughout the entire house.
Yeah. Okay, I get it. Yeah. So you're saying the inflammation in her lungs was like a fire sending out these mixed signals that were affecting other parts of her body, including her skin.
Exactly. And by putting out the fire in her lungs, so to speak, they were able to stop those smoke signals that were causing all the trouble on her skin.
Wow. This is incredible. It really makes you think about all these connections within the body that we don't always consider.
That wraps up part 1 of today's talk show. This literature summary is AI generated based on an actual scientific publication in a scientific journal. This briefing conversation provides a summary of the key themes and findings. For a comprehensive understanding, please refer to the original source document. We are Allergies. See you in the next video.